everyone. Happy Wednesday. Today we're in Pascagoula to meet the team who continue to take care of our guests no matter what was going on in the world or when the world stops. They kept us moving and kept us singing River Strong. But first we're going to hit it to Lee for the stats today.
All right, I'm very excited to introduce the Med-Surg team to you here, but statistically speaking, a little bad news. Our 7-day average is up to 4.9, about 5 per day. And that's partly a function of more testing. We're testing over 100 people a day. We're almost at 6,000 tests done. But the good news is that almost all of those are outpatient, very few inpatient right now. So that's the good news. Again, we got to reemphasize to people, if you went to a graduation party or some other function or gathering and there were a significant amount of people there, if you hugged or shook somebody's hand or shared a serving plate with them and they had COVID, you're probably going to get it. So please don't hug people, and if somebody's coughing, avoid them like the plague. If they're coughing, stay away. The World Health Organization just put out a study that said that
Very busy happenings around here.
a lot going on. That's what you get when you're live. But anyway, they put out that study that said that people that are asymptomatic are probably not shedding like they first started. Our contact tracing shows the same thing. So that's very consistent with that. But anyway, so today I'm excited to talk to you guys here on the first floor in Pascagoula 1 East. Julie runs this floor. So Julie, if you would, tell us a little bit about what you guys do here.
Okay, welcome to 1 East. We're a very busy place, as you can well hear in the background, but there's never a dull moment. We're a Med-Surg floor. We are ready for anything and everything that walks through the front door. We take any medical patient with pneumonia, COPD, quite the diverse diagnosis on this floor. So we have a tough team. They work hard and they're strong. They are ready for anything.
Who else do we have with us today?
Who else we got with us? Introduce them to us.
Hey, I'm Alex.
I have Alex and Becky.
The A team and the B team. I want to be on both.
Yeah, so Alex has been a nurse with us for 2 years, and Becky has been with us for 14 years. So we figured we'd have some good balance here as to their experience. So what inspired y'all to become nurses?
Well, I like to try to take care of people the best that I can, and I figured that nursing would be the best profession to be in, to take care of people, to help them.
And you've been here all 14 years?
I have.
So you must like us pretty well.
You know, I like to say that, people, all of us, everybody wants to make a difference in life and make a dent in the universe and do something to make a difference. And a nurse never has to worry about that. You guys always do whatever it takes to make that difference in people's lives. So, anyway, what about you, Alex? Sorry, it's very busy, as you can see. So the question was, Sarah asked was, what made you inspired to become a nurse?
Like I said, the big thing is, before this I was in the military, so I was serving already, and so when I got out, I wanted just to continue to serve the community, and I'm just out to make people feel better and help as much as I can.
And how have you stepped up during the pandemic? I know I've seen you on a few different floors during this whole thing.
I was on the COVID floor, and that was a fun experience, and once again, I just wanted to help. This is a crazy time, and a lot of people are feeling ill and scared, and if I can be compassionate enough to just be there and help them through it, it'd be great. So.
Well, you guys were all fearless warriors during this. People that worked on the COVID floor and all these people that worked on the floor that was the not COVID floor, the cold floor, the hot floor. Everybody doing everything is what it took. And one thing that I saw a lot of was our core values epitomized. So tell us a little bit about our core values. What's your favorite core value of ours that you ascribe to?
Teamwork would have to be my favorite one especially at this point in time with this virus that we have going on. I think that it takes a lot of teamwork for this floor because it's a larger floor, and just to make everything run smooth and to take the best care of patients, we have to be a team.
Everybody working together.
Absolutely.
What about you? What do you think about? How about tell us about care and communication? That's kind of one of the toughest ones, and that's a good one that nursing's really good at. Tell us about how y'all do that.
It's just making sure that we are rounding on our patients a lot, asking them what can we do to make them feel better. If it's something we can do, we try our best to make it happen. We do everything we possibly can to make this experience as comforting as it can, because they don't want to be here. Nobody wants to be sick.
So you have to be both a scientist, you gotta know the difference between milligrams and milliliters, do all the different things, the technical parts, but there's also the emotional support part of your job, right? Tell us a little bit about that.
We're treating the patient as a whole, the whole body. Physically, they're sick. Mentally, they're upset. They're dealing with this, and emotionally, I mean, it's chaotic. So we got to make sure that everything else is working and they stay strong to get through this.
Well, appreciate you guys describing our core values. What about yes is the answer? We got that one.
Yes is always the answer.
Especially when Mr. Bond's around.
I love it.
So what's your favorite
We
part?
at least do our best to make it.
Of course. You know, so what's your favorite part about working here?
My favorite part about working here is seeing these patients get to go home well. Because we see them come in sick, some of them be very, very sick, and when you can see them leave here much better than they came in, that is my favorite part.
Definitely very rewarding.
Very rewarding.
What about you, Alex?
Probably going to be the same. I mean, like I said, we see everything on this floor. We see a lot of sick patients, and for a while it's scary, and then to see within a couple of days they start peaking up and they get to go home and they're so happy, and it's great.
That makes you happy.
And taking care of our community, taking care of our families, taking care of our coworkers' families, and anybody in the community, and then see them out in Jerry Lee's or Walmart. Hey, how are you doing? And getting to kind of follow up with them and visit with them on a personal level. It's always rewarding to have that feeling of knowing you have made a difference with that patient.
Absolutely. And it kind of brings up a good point to that. You know, no one should be waiting to check out their symptoms. If you need medical attention,
right.
these ladies can help you get back to being well, and you can leave the hospital COVID-free, hopefully condition-free, or your condition under control. So please, you know, come see us. These ladies are ready.
The sooner they get, you get to help them, the better, right? I mean, always when people get care and get taken care of earlier in the stage of their issues, the better off they are. Well, thank you guys for being Singing River Stronger in this. What inspires me is you guys and how hard you work, and how, just like we witnessed during this, you know, behind us, you see people going every direction, working so hard every day for our patients and caring for them. So we deeply appreciate what you do. So thank y'all for being Singing River Strong. Can you give us all strong?
Thank you.
We're really strong.
There you go.
And you guys say Singing River Strong.
Just like them.